Sandra, first of all, how are you feeling today? You got the shot Monday morning. Any side effects?
No side effects, just mild soreness at the injection site, just like I get when I get the annual influenza vaccine. On a scale of 1 to 10, with 10 being the worst pain, this is a 1. No fevers, no weakness, muscle weakness or aches. I feel great. As a matter of fact, when I go home today, I'm going for a nice run.
Why did you want to be, Sandra, the first person to get this vaccine?
So, Katie, to be honest, I didn't realize I was going to be the first person in New York State or even the first person in the US to get the vaccine. I know I was going to be among the first at my institution to get it. And I wanted to get the vaccine in general, whether I was first or not, because of the pain and suffering and despair and death that I've been seeing since March, and how tirelessly and the sacrifices people have been making to save lives. In my role as a nurse, my job is to save lives, to prevent illnesses and death. And saving lives doesn't just mean when somebody comes into the hospital. I want to influence that before they reach the hospital. I want to be a role model for the Black community because I know that, typically we hear the word vaccine and we're like, no, before even being informed. So I want people to know that before you make that decision, become informed, listen to the experts, read whatever is out there, ask questions. That's how you become informed, not just, you hear the word vaccine and based on history. We have come a long way, and I feel confident because the vaccine is not just being offered to Black and brown people, it's being offered across the spectrum. And I've been listening to the experts for months. And so I feel confident that corners weren't cut just to put a vaccine out to cause more harm to people, that everyone really wants to stop the harm, stop the deaths.
What has it been like for you, Sandra, as a nurse, taking care of patients who have contracted this virus?
So in my role, Katie, I am the director for critical care nursing at Long Island Jewish Medical Center. Under my division umbrella, I have 4 intensive care units, typically with an incredible group of nurse managers and assistant nurse managers that support me in running this division. During the COVID-19 pandemic, it was all hands on deck. So I was in scrubs every day on the front lines with my team, opening up new ICUs as the volume increased to over triple our normal capacity. Normal capacity for the 4 ICUs is 48 patients. We surged to over 150 patients, and that volume continued for weeks and weeks and weeks. It was dark, the darkest time in my career as a nurse for over 26 years.
What about recently? Have you seen your ICU spike yet again?
So we are seeing a spike, yes, about 25% of where we were, say, March and April. But we're prepared. We're better prepared. Before, it just seemed like an ambush overnight, like out of nowhere, we were getting the volume just kept increasing and increasing and increasing. And we couldn't, it was hard to keep a handle on it. But this time around, we are well prepared. We have all the resources that we need. There's still this level of fear, but they haven't lost their courage. And that's what's important.
Can you talk about the emotional toll, Sandra, this pandemic has taken on you and your colleagues?
We will be going through this, Katie, unfortunately, for years. Every now and again, I get flashbacks of people just remembering faces, the many faces that I helped to, wrap in a body bag and to go to the morgue, or how many families that I escorted to their family member bedside to say goodbye, seeing my nurses doing FaceTime, holding hands while people died. I mean, those images will not be erased from my memory anytime. The nurses stood in, they were nurses, they were friends, they were family. They stood strong while family members said goodbye to their loved ones via FaceTime. That was incredibly important to them. And that's the art of nursing, the caring piece, that no matter what, we still have to care. So there's the science and there's the art, and they never lost the art of nursing, that caring piece that is so central to being a nurse.
You yourself, Sandra, experienced a terrible family loss in the midst of this whole thing. What happened?
So unfortunately, my aunt passed away, and also my uncle during this time. And, their children, who are my cousins, are just still suffering from this loss.
Were they in your hospital or in a different hospital?
So one was in one of my hospitals in Westchester, and the other, my uncle, was in Montefiore Hospital. It's just devastating. It hit close to home at work as well, as we unfortunately lost, not in my division, but in the surgical division, one of our workers, and that team is still suffering from that loss. He was an incredible worker, and he passed away in one of my ICUs. So, that really hit hard when you're working tirelessly and you feel like you can't even save your own.
What did he do, Sandra? I'm curious.
He was an amazing patient care associate.
So he was there taking care of patients, and then he himself became one.
He himself became one.
What would you say to people who are resistant to getting the vaccine, especially people of color?
I would say, trust the science. Don't trust COVID-19.
Have you heard from many people who appreciate the fact that you're speaking out, and especially to people of color, about the importance of getting the vaccine?
Yes, I've heard from so many people who have been flooding my email and sending me text messages. I'm originally from Jamaica, and they have been just sending me so many messages, thanking me for my bravery and for spreading the word how important it is to get vaccinated and to continue with the preventative measures. Because they said, they just yesterday, it was ironic that I was taking the vaccine yesterday, and their nurses were saying they don't want to be among the first to take the vaccine. So I've been doing a lot of just interviews there, hoping to change their minds, because they're a high-risk group. They're on the front lines. And so it's important for them to protect themselves.
You also had the person administering the shot, a person of color. And that was important to you as well. Why?
So the person who gave me the shot, Dr. Chester, she is the director of our employee health services. People are fearful because they don't see enough people that look like us, that are talking to them about the importance of being educated and preventative measures and taking vaccine. So I'm happy that it was people of color who they see talking to them and speaking to them about just their experiences that they've witnessed firsthand.
You have to have a second vaccine in 21 days. Are you looking forward to that?
I am looking forward to that as well, Katie.
How soon will you be protected from COVID-19 after the second shot?
I will continue with all the preventative measures, the meticulous hand hygiene, wearing my mask, social distancing, until the science and the experts tell me that it's safe not to. Obviously, we need a large number of the population to be protected before we will be able to take our mask off, and I am fine with that.
Did you get a lollipop after you got your shot?
I didn't get a lollipop after I got my shot.
Well, you deserve a lollipop and much more.